And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mele, and we're talking about a bunch of different topics. We are going to talk about arm lifts right now. A lot of women out there are thinking, I've got bat wings. Yeah. And bat wings are annoying, right?
They are annoying.
They're annoying. You can't wear sleeveless shirts, anything. Is that the best candidate, or what else?
The best candidate is someone who has really a lot of extra skin.
Yes.
So if someone has just that little bit of loose skin, if their skin isn't that loose and there's just some fat in there, sometimes liposuction is a better option. Because the downside to the arm lift is the scar.
Right.
So we've got a scar running from the elbow to the armpit.
Does it always have to be that long?
Usually.
Really?
There are some folks that just have that fullness in the upper part of the arm.
Yeah.
And sometimes a mini brachioplasty where the scar runs the other way and the armpit works. But most people are not a good candidate
Most people have to have the long scar.
Yeah. If you make a small scar, you're removing less skin. And if there's a lot of loose skin at the elbow, it's just not going to get better.
Okay. So is it mainly a lot of people that have large amounts of weight loss?
Massive weight loss is the most common reason. Yeah. There are some people who are just born with extra skin. But I would say on average, when I'm removing skin, they'll have twice as much skin as they need for their arm. Sometimes 3 or 4 times as much.
I hear a lot of people going in for the arm lifts. Is that getting more popular? Because you have to have that scar, but people are willing to get that scar. So, there's a lot of people going in.
The ideal candidate isn't worried about the scar. The ideal candidate can't get their arm in a sleeve because they have too much skin. And I can tell you, I have had patients who say, I don't care about the scar, I never wear short sleeves anyway. And afterwards, they're wearing short sleeves. Because we try to disguise the location by putting it from the inside of the elbow to the back of the armpit. And that way, when the arm's in most positions, it's at the bottom and hidden. See it. So it's just when your arm's overhead that you'll see it.
And it does pretty much fade over time.
It fades over the time. It can take a year for it to fade completely. The scars tend to be a little bit red at the beginning. Yeah. But once in a while, they'll end up raised or wide, and they're just not good to look at. And they can't always predict who that's going to be. And
you can fix that, right? If it's a raised scar, maybe?
Raised scars, wide scars, you can revise them, you can excise them again, but sometimes it's just the way that the arm wants to heal. Gotcha. And we end up with the same result.
Let's take a look at some before and afters.
Okay.
There we go. That's a beautiful result right there.
Probably has 2 or 3 amounts of skin that they need to cover their arm. And the same thing with weight loss, the arm was much bigger. With weight loss, that fat's gone away, and there's just extra skin. So again, the scar's right along the bottom.
Yeah, you can't even see that. That is a wonderful result.
And that's the goal. There's an alternative place to put the scar, which is right in the bicipital groove, which is be right in the middle of the arm that we're looking at afterwards. I just don't like that position. I think it's a little too obvious.
That is wonderful. You can't even see it.
And there's no way to do that with anything else. We don't have a skin shrinking ray that'll get rid of twice the skin that we need.
Would you please come up with that skin shrinking ray?
Yeah, and liposuction would just make it worse. Because we'd deflate it, we'd lose support, it would just hang more.
Okay, let's go to pick number 2 while I ask you. Bodybuilders, let's say you're bodybuilding and you really do, lose a lot of fat, and your arm looks pretty good, but you still have that little wiggle waggle. Is that something you should go in for an arm lift for, or is that just, nah?
If you're competing, you probably don't want to have that scar there.
No, okay.
It's like 1% of the time you can't see the scar, but it's just too small an odds to depend on.
All right, pick number 2.
So here too, you can kind of see the normal tracing where the muscles are before, and just all that extra skin.
It's really
in her case, it's kind of bunched up in the armpit. When I see the skin kind of going up towards the armpit, rather than just going straight to the side,
and very crepey,
the results tend to be better because we've got some support in there, and I don't have to worry about that sort of crossing over from the arm to the side that ends up bowstringing. That's the word we use for it.
All right, pick number 3.
So here's someone not quite as much skin, but really bothered by it. And in her case, the scar was really hard to see, but the skin on the back of the arm is tan. On the inside of the arm is light. So even though we can't see the scar, we can see this sudden transition.
All right, question. If you have, that looks like loose skin a little bit, then you tighten it up. Is that going to loosen quickly after, or are those, going to stay like that for a while?
Usually not. It depends on the person, their own elasticity, how much collagen, how much elastin fiber they have in the skin. But it ages at the normal rate. It doesn't come back faster. Now, if you were to gain a lot of weight and stretch it out,
it'll stretch out.
It'll stretch out again. That's
Another
what
pick?
skin does.
Yeah.
It's meant to cover us.
I don't like that.
Yeah. It's good if you're getting heavier, though. But afterwards, it's not as fun. So here, too, she had skin actually going all the way a little past her elbow. So I had to go a tiny bit past the elbow in order to really get that up.
Can you do a little elbow lift and just get those elbow? You know how
there are some people who do a lift kind of across the arm and take out some of that skin.
It's a great idea because the elbow.
But again, it's where the scar is, and what I worry about in that area is there's a bursa, a little sac that lubricates to keep the skin from sticking to the bone. And if that gets infected, it can be really hard to get better.
All right, do we have another
pick? I like to stay away from that bursa.
No more picks? Oh, you like to stay away from the bursas?
Because the worrisome things on that are there's a nerve that goes to the hand we don't want to injure, and all the nerves that go to the forearm go right past that inner part of the elbow.
So not a good idea.
So you want to see what you're doing and go carefully in those areas. And I like to find the nerves before I get too far along, so I know where they are and I can protect them.
Don't want to hurt them.
Yes.
What about recovery time, real quick, for arms?
Recovery for arms, pretty quick. Again, it depends on how tight the arms are, how much swelling there is.
Okay.
Most people, 1 or 2 weeks, are back to doing what they want.
Just cover it up while you go back to work, and you can get back to work pretty quickly?
I have them wear like a little garment that has sleeves, and it's kind of like a bra with sleeves. And
okay. So you can cover it up. All right. Sounds good. For more information about Dr. Mele, you can call 925-943-6353 or check him out on the web at either drmele.com or sanfranciscobreast.com. Lots more to come on Body Beautiful. Stay right here.